It is my pleasure to introduce our chair for today's session, Kristen Meagher. Kristen works on the R4HC MENA program and is currently undertaking a PhD examining the role of women's leadership and participation in health system strengthening in northern Syria. Kristen also leads and is a founding member of the Women Leaders in Health and Conflict initiative. This initiative is about highlighting the inspiring work of women leaders, as well as providing a platform and a network to address significant challenges and opportunities for women's leadership in this field. Kristen has recently published a couple of pieces in the British Medical Journal, one of which is titled The Role of Female Leadership in Conflict Settings. Kristen, I'll hand over to you.
Great. Thank you, Brad, and thank you everybody for joining. This is an informal discussion in which our panelists will provide some key insights from their own experiences in the field and in research, which will shed light on some of the barriers and also the opportunities for women working in health and conflict settings such as Syria. In which our panelists will provide some key insights. Today, I am privileged to be introducing our extraordinary panel of speakers. Firstly, I will introduce my colleague, Dr. Abdulkarim Ekzayez, who is a Syrian medical doctor and an epidemiologist. Currently, Karim is a research associate on the Research for Health and Conflict program at King's, while also undertaking his PhD. His research focuses on the public health impacts of conflict, as well as challenges around the protection of healthcare in conflict, both issues he has experienced firsthand in Syria. Karim is also involved in several other projects and research with other academic and policy institutes. In 2013, Karim was training to be a neurosurgeon when his residency was interrupted by the war. He joined Save the Children in northwest Syria, where he led the health response until 2017, helping build the primary healthcare system and restarting routine vaccinations. Karim is a regular contributor to several medical and civil society institutions in Syria and has been involved in active advocacy for Syria. Karim is also a trustee for two NGOs, Shafaq and Eye to the Future. He received his MD from Aleppo University and his MSc from the London School of Hygiene and Tropical Medicine. Today, Karim will be outlining the current COVID response and the role of community engagement and the gaps in leadership diversity presented through this current response. We are also joined today by Dr. Aula Fahham. Dr. Fahham graduated from Aleppo University in 2013 and was an ENT resident in the National Hospital of Hama City. However, Dr. Fahham left to work in northwest Syria as a field doctor. She worked in a local hospital of Darat Azar and in a primary healthcare centre in the countryside of Aleppo, where she brought with her her knowledge and expertise as an ENT resident. Dr. Fahham also volunteered to work as an ENT resident at Bab al-Hawa Hospital and the ENT clinic in Idlib. Dr. Fahham was awarded the Shedling Scholarship this year and is currently studying towards a Master's in Public Health at the University of Nottingham. So welcome, Dr. Fahham. She will be building on Karim's talk discussing female participation in health responses in Syria, both prior to COVID and currently. And thirdly, we have Dr. Aula Abbara joining us as our third panelist. Dr. Abbara is a consultant in infectious diseases and general internal medicine at Imperial College NHS Healthcare Trust in London, and an honorary clinical senior lecturer at Imperial College. Dr. Abbara has volunteered in different humanitarian and refugee settings, including direct clinical work and teaching healthcare workers. Since 2012, this has predominantly been with Syrian NGOs. Between 2016 and 2018, she led a project for SAMS, the Syrian American Medical Society, which provided over 30,000 primary healthcare consultations for refugees in Greece, and received a Women in Global Health Award at the World Health Assembly for this work. Dr. Abbara co-chairs the Syrian Public Health Network, and she also chairs the Health Professionals for Global Health, and has been a collaborator on the Lancet Commission in Syria. Her research interests include attacks on healthcare, AMR in conflict, refugee healthcare workers, and more broadly relating to global health and humanitarian health. And lastly, in February of this year, she received an Emerging Alumni Leaders Award from Imperial College London. So Aula will be speaking today regarding the politics that is also impacting gender and health in Syria. She'll also discuss the roles of different networks and diaspora groups and how they can advocate for more inclusive leadership and health responses in Syria. To conclude today, we will discuss some long-term solutions to support women leaders in Syria and possibly in other conflict settings. Today, we will also collate questions from the audience as we go along, and if appropriate, we will pose these to the speakers as we go through. Otherwise, we will just leave these until the end during the discussion. We will draw the conversation with the panelists to an end at around 30 to 35 minutes to allow for an open discussion. So, Karim, I will hand over to you to start today. Thank you.
Sure. Thank you very much, Kristen, and thank you for organizing this event. And indeed, the whole series of women leadership in conflict is playing a key role in bringing more attention to this important topic. And considering that I'm not the gender expert in this panel, so I will be talking mainly about the kind of setting the scene about discussing the gender role in health leadership in Syria, focusing on the COVID-19 response. So as Kristen mentioned, I was involved in building the health system in northwest of Syria between 2013 and 2016, when I used to work with Save the Children International, leading their health response there. And I still have strong communication and daily support to the health system northwest of Syria. So maybe talking about COVID-19 specifically, as you all know, that COVID-19 pandemic has brought new challenges to even the most developed health systems in the world. So for complex settings, these challenges could be much greater. And in Syria, because of the conflict, the health system nearly collapsed in a lot of areas. And now we ended up having more than one system. So what it used to be one national health system before the conflict, now we have at least 4 different health systems in the different areas of control in Syria. So the first one is the one run by the Ministry of Health in Damascus, which is the traditional health system, but still even this one, this health system lacks resources. A lot of health workers, they left the country. A lot of them were detained, tortured. So there are a lot of shortages, not only related to health workers, but also related to health, to medical supplies, and also related to health governance because of these, corruption, because interferences from the security agencies and from the political leadership in the country. And in northwest of Syria, we have another health system. So the health system in this area, in the northwest, which is under opposition control, so the health system here has collapsed completely, I would say, in 2011, 2012. And as a result of local efforts to build a health system from scratch, so there were efforts to build a bottom-up health system in these areas starting from 2013, and now we have relatively stable health system in this region, governed by a general assembly of most doctors operating in the region, which is very different from a health system that is governed by the Ministry of Health. And then, but this health system is suffering from a lot of challenges, including attacks on healthcare. Most of the health facilities in this region in northwest of Syria has been attacked at least once, if not more. And a lot of health workers were pushed out of the country, including maybe female doctors, because I would say female doctors might be less in such circumstances. They might be more vulnerable to violence, and therefore they are more likely to flee the country. And then we have the northeast of Syria, which is operated under the self-administration in northeast, and they have a different health system, slightly similar to the pre-conflict health system, But the problem that in these areas in Northeast, there are a lot of gaps even before the conflict. So they have huge shortages and gaps in terms of available resources. And then we have the fourth health system, which run under the Turkish controlled areas. So closely supervised and monitored by the Turkish Ministry of Health in the areas where the Turkish army has a presence in northern Syria. So having different health systems would not help in building a national response for such pandemics. These sorts of diseases, you need a holistic approach, a national approach to approach these pandemics. But at the same time, the isolation of few areas played a key role in protecting these areas from importing the virus, and this was the case in northwest of Syria. So what's the status currently, briefly? So the number of confirmed cases in Damascus or in the areas operated by the Ministry of Health and northeast of Syria, we have around 5,100 cases and 250 deaths. But however, these numbers are being criticized that they are much less than reality. In a study by Oliver Watson and others at Imperial College London and other institutions, they concluded that around only 1.25% of deaths due to COVID-19 are reported in Damascus city. So these numbers could be much higher. And in northwest of Syria, we have around 3,100 cases and only one death. And it could be very surprising. We do not have a lot of mortalities in these areas. And now there is kind of an emerging interest by researchers to look out why in humanitarian settings and even in low income settings, why there are no much deaths as was expected before. So we might need to rethink about the estimation of mortality and morbidity. I will focus here about northwest of Syria and focusing on identifying the gaps in gender. So the response in COVID-19 in northwest of Syria, I would say, was innovative for some parts of it. And then there are some gaps. Starting from the innovation parts, having a health system with a huge shortages, in northwest of Syria, there's only 1.4 doctors per 10,000 people. There's 0.6 hospital beds per 1,000 people. There's only 5 intensive care unit beds per 100,000 people, and only 47 functioning ventilators in the whole region. So we started the response with these numbers, and it was very challenging. And the first kind of agenda was to delay the onset of the pandemic, of the outbreak, until we prepare the health system further. And the key point was the non-pharmaceutical interventions, and mainly, talking about border controls, raising awareness, and also sterilization of public places and other social distancing measures. And the problem here that the lack of governance in this area was a challenge because there is no Ministry of Health. And here the Idlib Health Directorate and the White Helmets, which is known as the Syria Civil Defense as well. So these two organizations played key role in building a governance system specifically for this response. And they called for all NGOs and community grassroots organizations to be part of this. And there is one very good example of these community engagement, which is a massive campaign. It's called Volunteers Against Corona. So currently the campaign have thousands of volunteers covering mostly like all neighborhoods and all villages in north of Syria with kind of central coordination. And this governance system, is very hard to build in a place where there is no proper government, there is no state. And here there are some key rules that were played by women at community level. But I think the gap was on governance leadership level. Because in these areas, we lack gender diversity and women involvement in the governance and the health governance of the region. So, for example, in northwest of Syria, the health system is governed by a board of trustees, around 8 or 9 people, and those are elected by a general assembly of around 200 or 150 doctors from the region, which is, an alternative governance system, which is very innovative. But the problem that since 2013, there has never been even a woman in the board of directors who govern the health system in this region. And even recently, only in the last 2 months, because there was an election, they were changing the health director in the region, in this region. So a woman, nominated herself to be for the election, but she was excluded because the criteria were very tough. And these criteria, it could be argued that no woman can, under these circumstances, in these kind of cultural constraints, no woman could succeed in, being appointed as a member of a director of the health governance. And this caused frustration when I talked to this doctor, who is a very brave gynae doctor, leading a hospital. She's a hospital manager in Idlib city, and she's well known for her, leadership skills. She was very frustrated that this health system that we trusted and we tried to support over the last few years did not support us as women to be part of it. And I think this is a major gap. And I would like to highlight one last point that could be considered as, an area for women innovations and involvement in supporting the COVID-19 was research. Because, most of the work done in the field was the practical, implementation activities, but there is a whole set of research behind these activities. For example, here we have Dr. Aula Abbara with us. Dr. Aula was a very good example of a female doctor who really led efforts in, conducting more research on how to support this this response. Another example is a study about modeling the expected number of cases in northwest of Syria, which was done by the COMO modeling team at Oxford University. The study was led by a colleague, Manar Marzouk, and she led a team of co-authors from from the UK and also from the region, which is one step in the right direction. That research could be an entry point to change and fix issues, to ensure that women have more involvement, more engagement, and they have their place and their position in the health governance in the region. And this could be a lesson learned for other conflict settings, while we need to highlight the important role that women play in health governance and how we can overcome the challenges related to this. And I will leave it here to Dr. Aula, and Dr. Aula, to Dr. Fahham and Dr. Abbara to expand more on the gender role in this response and in health governance in general. Thank you.
Thank you so much, Karim. So next we'll be hearing from Dr. Aula Fahham. Thank you.
Yeah, hi Kristen, hi all for you. I'm so happy to have this opportunity to share my humble experience and insight actually. I just want to say, I want to differentiate between participation of women and their leadership position in general, actually, because women participated since the beginning of the Syrian uprising. There were female doctors, there were nurses, midwives, humanitarian workers in the field, even civil defense volunteers. Even during the COVID-19, there's women in hospitals too, there's in community-based isolation centers, and there's a significant role for women as community health workers. They really work great to raise awareness among camps dwellers and among households. But it's Karim mentioned, really there is really lack of a presence of women in leadership position in powerful and influential roles. Actually, even the Northwest COVID-19 task force, which consists of almost one woman and almost 30 men, which supposed to lead the response plan in Northwest Syria. So that really speaks volume about the subject. And when Dr. Amani Ballour, her documentary, they called The Cave, when I watched it, I was really overwhelmed with my feelings because I could relate, even though she worked in the very south of Syria and I worked in the very north. She was also worked as a hospital manager, and her role was always challenged by her community. She doesn't have what it takes to be in such a position. So I could relate. Actually, the whole world maybe could relate to this. And that's why her experience was so significant. Maybe in Northwest Syria, as up to my knowledge, I think only 2 female doctors like works as hospital managers. Also, in the NGO, I believe maybe like most of projects led by men on the ground. Maybe like there is some exceptionals. That's the case. So I believe that like community fixates on women gender's role, and the religious extremist point of view really add no favor to this combination. And that's why speaking up about this problem, highlighting this, it's really a stepping stone, just like to overcome this. Like that's like looking when I worked like in Northwest Syria, as originally I'm from Idlib district, I have a duty of care. That's why like I stepped up. Like I felt at that time like my work like in the clinical medicine, it's most important at that point. But when I looked around, I see a lack of presence like of women in this really key position. That's why I applied to the scholarship. I want to advance my leadership like for the future sake, and I want to pass inspiration and spark such kind of response from other females. So like hopefully that will work really. That's really what I could say about the subject. It's not that much, but I lived every detail of it, and I feel for my colleagues whether it's like enough to live in a hostile environment, but really women face much burden than anyone else. That's what I wanted to say.
Excellent. Thank you so much, Dr. Aula, Fahham, for sharing those insights with us, having come from Syria quite recently. Now, Dr. Abbara, great. Do you want to continue?
Cool. Thank you very much. So I just wanted to add just a few words, just to kind of follow on from what Dr. Abdulkarim and Dr. Aula Fahham have said. And I think the first and probably most important is just to reiterate the differences between leading very locally. So a lot of people who might be working as doctors might be local leaders. So they might lead a team of 3 or 4 people. And somehow in Syria, there is some acceptance of that. And the issues do arise when they start progressing through their career, or when they start progressing up in whether it's the local hospital management, or whether beyond that to kind of local councils, the Idlib Health Directorate, and kind of further afield. And actually there's very few examples of women who are really able to be not just willing to do that, but I would say supported to do that. So as I think back on the times where I've progressed through my career, it's often been with the help and with a hand in front of me. And for me, what's very interesting is it's often been by men who have supported and helped. And that's why men need to be part of this conversation. And it might be just because I work in a very male-dominated field, but for me, that's always been poignant. And for us, whether we are in Syria or outside of Syria, or anyone who's working in conflict-affected or humanitarian settings, particularly for men, but also women, we should be empowering the next generation of female leaders to progress, and always keep an eye out of what advice that you're able to give, and how we can empower them even further. I've volunteered on and off since 2012 on the Syria response, and I've been astounded at the resilience, strength and quality of the women who are emerging from what we all know is one of the most horrific conflicts that we have in recent history. And I think what happens is, if you keep fighting societal pressures at every step of the way, and every step is difficult, you are going to get tired and you are going to get bogged down. So providing mentorship and support to women in these situations is fundamental, even if it's just to say, keep on going. But also we should be opening up opportunities and providing opportunities for women to be sitting at the councils, to be sitting in positions of influence and power. And so that made me reflect on what's happened with the Syrian conflict. So I think it's important for us to be honest. So I'm Syrian, though I was born in the UK, but I've certainly experienced some of the discrimination that Syrian women would have experienced. So I come from a very conservative part of Syria, and it was very interesting. So there were certain expectations of how you must behave. And sadly, the conflict has destroyed our society, destroyed our communities. And it's been done in, and I think something that's important for us to think about is the intersectionality, so beyond gender, but also the education of parents, the education of the local community, wealth and employment and opportunities for education, because I think they all go hand in hand with the way your parents or your family might perceive what you're able to do, whether it's to become a doctor, whether it's to enable you and allow you to progress more and more in whatever chosen field and in leadership that you have. It also made me reflect on something that happened actually before the war. So I was aware that my aunt had always wanted to study medicine, and she managed to get into medical school. And she lasted 2 years, so this would have been in the 90s. And what happened 2 years in, so she was hitting about 20, and then the rumours started. And the rumours weren't really about anything scandalous that she'd done. They weren't about anything that, you know, any of her behaviours. It wasn't anything like that. The rumours were really about why is she doing this? She'll get beyond 20 and she won't be able to get married. She'll be wasting her life at university, and then she'll be wasting her life working, you know, whether it's as a physician or something else in future. And unfortunately, because she didn't have the right sort of support around her, she left medical school, got married, and became a homemaker, which of course is perfectly okay. But it does make me wonder what could have been done to support her. And there are a number of women who are physicians, who are leaders, that can manage both those things. And actually what's very strong about Syrian society is not an either or. If you have children, because of our family networks, you know, you might have an aunt or a sister or someone else that's going to support you with your family. So you are perfectly able to do both. Unfortunately, what's happened because of the conflict is the destruction of our society. And I'd like to hear what Dr. Aula and Dr. Abdulkarim have to say about this. But there is a feeling that even in areas that weren't particularly conservative before the conflict, they've become increasingly conservative. And that's everything from the way people speak and dress, but also opportunities for education. And I keep going back to education because it's fundamental. So I spoke to Munzar Khalil, who's the former head of the Idlib Health Directorate, in about February of this year, because I was asking him about the health situation in northwest Syria. The thing he wanted me to highlight was the fact that, so if you remember at that time, there's almost there were 1 million people who were displaced in a very short period of time. And he kept saying to me, look, there are 400,000 children out of education. And he kept reinforcing this. This is really important because education empowers. It empowers men, but it also empowers women. And that's why when we look at the extremist groups in different parts of Syria, when they started to restrict the education of girls and of women, you could see a very dangerous trend. There's a frightening statistic, which there's over 2 million Syrian children who are out of school. That's devastating for men and boys, because what happens is these boys can get drawn in, perhaps as child soldiers, perhaps in child labour. And sadly for women, that means early marriage with all the risks that are associated with it. And that means we're losing a generation of potential female future leaders who haven't had the right support and haven't had the right opportunity for them to be able to progress. In terms of women and leadership, there's something else that I wanted to highlight. It's perhaps something broader, but it's highly applicable to what's happening in Syria in terms of women's leadership. There are certain expectations of men and women, as I've said, in Syrian society and how they are to behave, and something that we as Syrians need to address. So for example, there's a word that I'm very afraid of in Arabic that's often used to describe women who might pursue their studies, might pursue leadership positions, who are unafraid, such as Dr. Amani Balour, such as Dr. Aula Fahham, to go after the positions, to go after those positions of influence. And in Arabic, the word is mustarjili. And what that means is she's just like a man, and it's meant in a very derogatory way. So as a Syrian society, one that's been particularly degraded by conflict, we've not embraced the fact that you can have strong women, inspiring women that can sit at the same table in all the committees, in all the meetings alongside men, stand up for the rights. So the important thing about having women at these tables is because they will speak up. They'll speak up for a lot of things, so not just about things related to women, but they will speak up for other women. So all the things that perhaps men may not know or be aware of, and they may not mean that in a negative way, but women will know what it means to deal with a lot of the kind of challenges, but also everything from sexual and reproductive health to mental health, and all the other things that we need to advocate for the rights of women. A few years ago, I was at the World Health Assembly at the launch of Women in Global Health, and it was the year that Tedros was elected as the director of the WHO. And there were two other candidates, and this is an important thing for women and men to understand and hear. So there was a female candidate that stood up, and she was a Pakistani cardiologist, and she was excellent. And she listed every single reason why she would be good at that job. And then the next person that stood up to speak was an English man who was also very good, but he didn't list anything about why he was good for that role. He stood up and said, "This is who I am, vote for me." So there is that sort of expectation that women need to prove their worth to have that seat at the table. Whereas sometimes I notice that for men, they don't need to prove it in the same way. They don't need to stand up and say, look, this is why I'm qualified for this role. And that's important because it relates to our perception of leadership. So, and I'm embarrassed to say this, when I think of a leader, I probably do think of a man more often than I think of a woman. But actually, if that's the perception that I'm having, it makes me wonder what role models that we have. So it makes me wonder what role models that Syrian girls have and also Syrian boys have, because the more they see women taking up these positions, the more they're going to want perhaps their daughters or their sisters to be able to step into those roles and understand the contribution that they can make. I'm just going to touch on a couple of things relating to the diaspora and what we outside of Syria can do, and also these networks that are outside of Syria can do. I really like that Dr. Karim mentioned Manar Marzouk's work. She's a public health specialist. She lived the war. She came to Oxford to do her master's, and she led a team, the whole team were men actually, and she was respected, and she took this project from the beginning to the end, and did it with grace, with strong leadership, and this is something that we need to see more of. And beyond that, we need to be supporting women such as Manar to be able to do that. So we in the diaspora need to have our eye on women who reach out to us and say, look, I'm very interested in this, and provide that support, provide those opportunities. And beyond that, and this is something that happens more and more, and it's not just particular to Syria, I've seen it happen at other international universities, particularly in the Middle East, the women might be considered good enough to be research assistants, but then those next steps or those next positions, you know, as project leads are often taken by men, whereas the women are really doing a lot of the work, whether it's the qualitative research or the quantitative research that is needed. And so what we need to be doing is understanding how to help women progress beyond that. So I think there are some things that we can do in terms of supporting women leaders who are in conflict. And of course, today we're talking very much about Syria, but I'm going to stop there because I'm hoping some of those will come up in the discussion.
Thank you so much, Dr. Abbara. We're just going to move on now to some questions. We've had quite a few questions come through. So the first question that we have is, what more can human rights groups and Syrian civil society do to support or pressure groups, to include more women health leaders in Syria. I'll open that maybe to Karim or Dr. Fahham. Did you maybe want to provide some insights on that?
So I will start with a good example, actually, if you allow me, Kristen. The first example came to my mind when you were reading the question was the very good movie. It was called The Cave, which was about Dr. Amani Balour. Dr. Amani Balour was a hospital manager in rural Damascus, and she experienced the whole siege of the Eastern Ghouta and the attacks, and she was evacuated only when the area was taken over by the Syrian regime. So the movie itself not only talk about the heroic activities and interventions implemented by Dr. Amani as a hospital manager, but the movie discusses in details these cultural problems. So I think having more attention about this issue through the social media and the advocacy work, how it's important to highlight the work of women. So if we have successful examples of women leaders in conflict settings, we need to highlight these more, because most likely this will not be given proper platform locally. So we need to support this even internationally. So I gave another example of a doctor who is a hospital manager in Idlib city. She's leading, one of the biggest maternity hospitals in the region, and she contributes not only to, maternity and child care, but she also contributes to, general health system strengthening issues and health governance. So we need to highlight her role, because this could, make those women as role model for other people, and also only by highlighting the issues, we start to challenge the traditional understanding and the traditional social role that women are expected to play in such settings. I remember in the Cave movie, there is one scene when a patient was discussing with Dr. Amani Balour, saying, "I cannot accept that you lead a hospital because women, they're not supposed to be leading. And yes, I can accept you examining my children, but not leading the hospital." And she was explaining to him, in rural Damascus, inside Syria, not only Amani Balour, but also the other male doctors and administrative workers in the hospital. They were explaining why it's important that Dr. Amani is leading the hospital. So I think highlighting these examples, starting to discussing these issues, not waiting, because other people would say, let's focus now on the conflict itself and all other issues will come later. I think we need a human rights approach cannot be, divided. We need to discuss about all these issues as a set of human rights principles that should be respected.
Great, thank you, Karim. The next question that I have, Dr. Fahham, I think you might be able to provide some further insight into this. Can you please give us some examples about the social and cultural challenges that Syrian women face to be leaders, perhaps challenges from families or husbands, or age gaps, or gaps in training opportunities between women practitioners and their male leaders?
Yeah, that's actually the problem. There is really no real expectation from women. You could say we have this kind of common saying that women will end eventually to her husband's house. So she will be mainly her job in life. Like I have said, the community really fixates on women gender role, like to be homemakers, like to be a wife, like to bring up kids. That's her utmost ambitious. That's what they think that women should think about. There is no ambitions beyond that. If she could have a career, okay, that's okay, but it should not be affected her home job. That's the main issue. So there is really no empowerment for girls' education. So I would say about myself, I have two sisters, but they got married into their teenager years. Even like they were supported, but like they said, the whole community around them, they accept like much more women as a homemaker. For me, I was like so privileged that I get into medical school because I insisted like I wanted to have a role beyond being just like a female. I wanted like to achieve something of my name, of my own name. So specifically, I would say like that's so prominent in the rural areas, like in northwest Syria. And actually, after the conflict, like Dr. Abbara mentions, it's really like the society got much more backwards regarding the social life. So when I got like into clinic in northwest Syria, I have got so many of my patients. They were teenagers and they were married. That was so shocking, and the rate was increasing every year. So that's the main problem. We have really no women role models like to look up to, and like it's it's, I don't know, even like I'm so embarrassed like to say that like in 2020 still like we need like to lead this discussion about how women participation is so important, like to include the half of population on the earth, like to get more involved in their community. And but it's that's the reality, you know. That's the reality, and we need like through education mainly like to really how like to exclude this thoughts from people's mind, like women should not like step up if she had like another qualified man in the same position, because that's the main principle. Like if there is another qualified man, women should step back, because like she should be like more concerned about her reputation, like she is so modest. So our modesty and our religion in somehow taking like they take advantage of this, and it's taken against us in somehow, and we need really like to be enlightened about that. And I don't think there is another way besides like starting from the new generation, from the beginning, from primary schools, and like to increase girls in education. And like it's like I would say like personally, when I'm now in doing master degrees and I am being asked about my opinion in every step, our education system really doesn't ask about that. It's like we got all these kind of information dumped on us, we cannot reflect about anything or like being creative. So like the whole system in Syria doesn't really set you up like to success. It's like the opposite, set you up to fail in somehow. And it's like so kind of painful like to see the scars of the example of like successful women leaders. So Dr. Karim mentions only two, so that's so sad, you know. It's like being woman is acceptable like to be like okay as just like a participant, but not in the lead positions. So it's just like we need to change that up. I don't know how, but besides education, maybe like also the NGOs, if they could impose such kind of policies about quota in the workplace, because we really also lack this. Even like in Turkey, and the like NGOs in Turkey, in their office there is also a lack of women presence there, like leading projects like in Syria. So yeah, that's what I want to say. I want to say like essentially religion and like the women, the community point of view about women participation, it's not that important. That's why.
Thank you, Dr. Fahham. That was excellent. It's really detailed. Hopefully we've got time for a couple of more questions. Dr. Aula Abbara, this question is for you. This is regarding a scholarship scheme in infectious diseases at the American University in Beirut. Women who graduate from the program face many obstacles, specifically in this field, to find jobs, as the field in the region tends to be very male dominated. Could you perhaps comment on your perceptions about how this could be addressed? Thank you.
Thank you very much for the question. I think it's very similar in some of the topics that we've actually discussed about the role of women, the opportunities that are made for women, and also the employment opportunities available. Something that we really need to understand is Syria is not easy for men at the moment at all, and that includes with unemployment, that includes with poverty. So more than 80% of Syria's population is poor, poverty rates were high and are rising even further. So we are in a situation where there aren't enough opportunities for all the talented people that could apply for them. In terms of women being able to progress in what tends to be a very male-dominated world, I think it's really difficult. I don't necessarily believe in quotas, but maybe as a stepping stone, that's something that should and can be discussed. But I think putting quotas in place without added support and added thought can actually be counterproductive. So when you have tokenistic quotas, you may not necessarily be empowering and actually providing the right opportunities for women in these positions to flourish. However, there needs to be a kind of a more holistic process around encouraging women to apply into these jobs. And the holistic process would include, like we discussed, it's mentorship, it's women that they perhaps can see themselves in the future, that they might model how they work and how they are in, but it's also all the other things that women, and I'd say to an extent men do need, but it's things around maternity, pay, support for for children, those sorts of opportunities as well will allow women to work. I think, as I said, I think it's actually probably intersectional, and there needs to be a number of cross-cutting things which support women to work in infectious diseases after they've completed the scholarship that Jocelyn mentioned.
Great, thank you, Dr. Abbara. So the next question that we have here, probably directed to you, Karim, is regarding the criteria on female candidates which did not fulfill the board of, I think it was the board of directors that you had mentioned. And so how could this criteria be enhanced to include women?
So the criteria were not specifically, differentiating between men and women. However, for example, one criterion was the person or the nominee should be having kind of leadership roles in the medical work in the opposition-controlled areas for 7 years, which you cannot expect this for women, because usually, especially in the beginning of starting to work in field hospitals, it was too risky. And in an environment like Syria, women cannot, work in these field hospitals in the opposition-controlled areas where, they were really kind of an unknown environment for them. And for this specific, for this specific doctor, female doctor, she used to work under the Syrian regime, but supporting a lot of patients. So she, in terms of, her kind of human rights approach, she was doing the right thing, but this was not considered as part of fulfilling this criterion, because she was not working under opposition-controlled areas in kind of a leadership position. And we were arguing that this criterion should be, different for female workers, because we know the challenges they face in the Syrian context. We cannot, expect them to be, having exactly the same achievements as men, considering the challenges. So this is a pressing example of how, one criterion could be argued that, there is no discrimination here. But I think there is, considering the different challenges facing women, and without giving proper consideration for these challenges.
Great, thank you, Karim. And we've just got time now for one last question.
Could I have just like one input, Kristen, like about women's situation? I just want to tell you that women really sacrificed a lot during the Syrian uprising, but they didn't get the recognition the same as men. Like take, for instance, like women detainees, right? Like when men got released from the detention because like they were like of their political opinion against the Assad regime, they will be dealt as heroes, and they will be celebrated, and they will like get so much attention, But when females like would get released, they will deal with stigma, and even like a lot of them got murdered because like of the doubt of getting raped, So do you imagine how the scope of the problem is, like, because in somehow women really consider like their modesty and their body and somehow it's not like belong to her, so it's belong to the family's owner and somehow. So it's so painful to talk about that because I worked in the field of documenting for ex-detainees, so I heard a lot of horrible stories like how like they were not supported and how like even a lot of them need like to move to Turkey just like to flee the oppression not only of the Syrian regime but their families how could I say it, revenge and somehow so there's so much shaming, there is so much derogatory look at women somehow. So that's what I'm like hoping and somehow to change in Syria and like to see like women as a human being. It's really doesn't important like to be women in a leadership position or a man. We just like need to be dealt with qualified person, like to be dealt with fair. That's the whole point. Like I don't think that religion there should be matter and this topic as a whole. So sorry for like but I said I felt like I need to say this.
I think that's incredibly important, and thank you so much for sharing that with us as well. I know it's not always easy to share such things.
Exactly.
So we're just going to take one last question. Hopefully we've just got a few minutes left. Would you be able to reflect on the situation in northeast Syria on the gender and female health workers' engagement there, given the difference of the power controls in the two settings? Perhaps Kareem, did you want to say something on this?
Yeah, I think it's a very important question, and really thank you, Dr. Fahham, for raising this question. Because as you know, in the self-administration areas in northeast of Syria, there is something called the joint management or the joint administration, I think, which is specifically talking about joint between males and females. So for each department under the self-administration, you will have two leaders, you have two positions, one for male and another for female. For example, the health department, which operates under the self-administration, which basically represents kind of a Ministry of Health there, it's led by two people, one male and one female, which I think, you know, it could be a good solution, temporary solution, because considering the challenges in the Syrian context, this could be only a temporary solution while we reach to the, you know, the ideal situation where we have men and women having equal opportunities and they can get to these leadership positions equally. But however, even in the northeast of Syria, this is only applied to the kind of the senior leadership positions, and there is no kind of a tackling down effect. So if you go to the kind of the granular details within the, you know, how health facilities are managed, how health resources are allocated, you would find that this joint administration or management is not reflected on the whole levels, and it could be, you know, one step in the right direction, that there is kind of a try to fix this issue on a leadership level, but this need to be, you know, meaningfully translated in giving these women in the leadership position the power, the required power to effectively lead, not to be only named as, you know, joint leaders.
Did anyone else want to add anything, or can you leave it at that? Okay, great. Well, we only have a few minutes left, so I think I will wrap up today's webinar. Thank you again so much, everyone who joined and everyone who presented today. It was incredible to hear all of your insights, particularly those harrowing insights as well. And it was really great to think about how we can all actually support this work. You know, challenging our perceptions of leaders, challenging the traditional social settings, and how obviously conflict exacerbates that. I think there are definitely more questions that I had, so perhaps I need to organise another webinar so that we can continue these conversations in conflict settings all over the world, and of course in Syria. So thank you so much again, everyone, for joining. And we look forward to hearing from you all again soon.
Thank you very much, Kristen.
Thank you. Thank you for having me, Kristen. Thank you all.
Thank you.